Hello, I'm Megan Friedman, a reporter with Hearst, Connecticut Media. It is March 31st, and I'm here to have a conversation with Professor Nick Nicholson of Quinnipiac University, whose research, you're a nursing professor, right?
Yes, that's right.
And Professor Nicholson's research focuses on the impact of social isolation among senior citizens, which is obviously, as the COVID-19 pandemic unfolds, more pertinent than ever. And so we're just sort of going to talk a little bit about that and what people can do to stay connected. But why don't we just sort of start off by, if you can introduce yourself and tell me how you got into this area of expertise? That would be great.
Yeah, absolutely. Thanks for having me on this interview, Megan. I'm Nick Nicholson, again, like you said, from Quinnipiac University. I'm in the School of Nursing. I'm an associate professor there. I've been at Quinnipiac since about 2012, and I've started my research involving social isolation in older adults probably about 15 years ago, 20 years ago. I became interested in social isolation in older adult populations while I was in the clinical setting. Many moons ago, I worked on a nursing floor before I was a full-time faculty member. And when I was there, I began to see, most of the patients I saw were older adults. So I had an interest in them and a great respect for the generation, just always, probably from my family upbringing and all that. But when I was on the floor, I always wondered a little bit about like the social interactions between families, but that was sort of the extent of it. And then when I started to see more and more people, when I moved to a cardiology floor, I started to see more and more people come into the hospital, and they were in these exacerbations of congestive heart failure. They couldn't breathe. They had a lot of fluid. What we would do is we would diurese them. So we'd give them medication, we'd get the fluid off, we'd get them back into shape, and then we'd send them home pretty quickly. This was, a while ago. And then what would happen? We would see them back in another week. And I would start to see these same people over and over. And I began to think, wow, why is this person coming back so often? Isn't there somebody at home that can kind of help them? Don't eat the salt. Don't eat the bad stuff. Keep your blood pressure good. Check your weight. So then I began to explore like, oh, well, what if they live alone? What if they are alone? What if they're socially isolated? So I began my endeavor into community health nursing and public health in general. So I took my fight to help older adults into the community. So I started doing visits in homes. I became a community health nurse. And then I started to look at their environment and what could be done in their environment. And then I continued that work through my PhD program, and my focus there was looking to find predictors of social isolation in older adults, and now I'm working to try to reduce that. I've got a program that I'm testing now that looks at creating individual group sessions to help older adults who are isolated become more socially engaged.
So one thing that just sort of came to mind in terms of this follow-up care, you said that you were seeing these people come in repeatedly, and you sort of realized that it was probably because they didn't have people at home to help them. I imagine, I mean, that also applies to the COVID-19 pandemic, like people who are recovering from it. Older adults, if they don't have someone to help them at home, what are they supposed to do? Is that something you've been thinking about as well with this, or because it's more of a shorter term, not because it's not a chronic illness, is that less of a worry?
Well, I think that what's going on with the COVID-19 now, I think that there's a lot of unknowns, and I think that can be really settling for older adults. So we're talking about a couple of different things. One is the immediate impact about the health, the infectivity, and keeping people away. So a lot of people are calling it social distancing, and I've started to call it physical distancing, because we can't keep people away from each other socially anymore, because that not only is bad for your health now, but in the long term as well. There's all kinds of negative health outcomes related to being socially isolated. And by asking individuals to physically isolate now, it's a really good thing, because that physical distancing helps people. But it lays the foundation later for all these other health issues that we need to be concerned about. So we want to keep people connecting with each other.
So what is the difference between physical and social isolation? How would you distinguish the two?
So social isolation, for me, I look at that as the distancing of an individual psychologically, physically, or both from his or her network of desired or needed relationships with other people. Um, so it's a little bit of the how many people do you see, interact with, and also your feeling of belonging.
Mm-hmm.
That's all part of social isolation. I have a specific instrument that I created and tested to measure social isolation in older adults. It's a 6-item question. Half of it looks at objective, and then half of it looks at more of this subjective piece. So it's connectivity and then belongingness. I think that physical isolation is okay, and it's really needed, especially in this situation where we have an infectious disease that we're learning more and more about daily. We need to keep apart. That's the only tool we have in the tool belt right now. Everything else we have is under investigation. The vaccines, the medication, everything else. So we want to stay clear of the hospitals as much as we can. So the only way to do that is to stay away from each other. The way I look at it is we're basically operating in this particular instance in this very small space and time, like before we knew anything about germs or we had antibiotics or any treatments or vaccines. We're operating in a time where the only way to prevent this is to not get it in the first place.
And so in terms of physical isolation people can maybe feel like that goes along with social isolation, I would imagine, especially in maybe older adults where they're used to meeting people face to face, as opposed to, like my generation, we're always talking to people over Facebook Messenger or,
Yep.
Instagram and whatnot. Does that put older folks at a higher risk of being socially isolated when there is physical isolation, that sort of comfort level or literacy with technology?
I think that it does pose an additional risk. I think there's a growing number of older adults who are more and more comfortable with technology, and that's a great thing to be at this moment. If you're comfortable with technology, you're in a good place. If you're an older adult and you're not too sure about technology, now's the time, because there is a little bit extra time because there is all this physical distancing. Now's a great time to connect with a family member if you can. Find the youngest person that you know, talk with them about the technology. And a lot of it's not as difficult as people think. One of the main barriers is thought that it's so difficult that they won't be able to, it's too difficult, I can't figure it out, I won't be able to open it up. But that's not always true. But I think if people are physically not able to be near each other, I think you do run the risk of becoming more socially isolated, because the face-to-face meetings do have a lot of value. I weight them very highly as far as getting social engagement benefits. So face-to-face is probably the number one. I think if you're not able to be face-to-face, I think a video chat is probably a decent second place. And then from there, it's tough. You've got phone calls, which are good. I think text messaging can be okay as well. And you've got emails and some other things too. But I think that if you are able to set up time where you can do texting, video chatting, I think if you do enough of that and you do it consistently, it can make up for that void that you'll feel from the physical isolation. And I think that's what people need to do. They need to make time, create a social calendar to connect with family members, friends, to try to build back that connection that they've lost.
And for folks that can obviously apply broadly to really anyone, but especially for, if we're talking specifically about senior citizens, how about folks who are not senior citizens, either individuals or communities? What can they do to help? Like if it's whether it's a grandparent or whether you are someone who runs a senior center in town, what can communities do to help people stay more connected during this time?
Yeah, I think, one thing that I think is really important is to try to reach out to people in your neighborhood. Now, I am by no means suggesting you go knock on people's doors, but oftentimes you'll exchange phone numbers or emails with your neighbors or people in your community, sort of like, well, if maybe the mailman delivers the wrong package to, can I have your number to contact you? Or sometimes people already have like arrangements made. I think it's a great idea to kind of connect with other people and just kind of check in, just send a message, just how you doing? How's it going? I think that's a really powerful first question. I think that's something that all people should do and can do. I think in times of crisis like this, one thing that we can do that's really important is we need to take control of what we can control. And one thing that we are able to control is who we contact. So I can take 5 minutes out of my day and contact my neighbor and just say, hey, how are you feeling? How are you doing? Is everything okay? Is there anything I can do for you? I'm going to the grocery store. Can I get something for you to save you the trip? I can leave it at your doorstep. Just something as simple as that will really go a long way, and it also helps to build community. I think another thing that people can do, and again, do that technology check. If people are savvy enough and they can get online, try to connect with a group of people who are interested in similar things. There's lots of blogs available. Some people like Reddit. I mean, there's all kinds of sites where you can go and find people who have common interests. I mean, you could post pictures of your pets or, animals, and, that's a great way to kind of connect with people in a meaningful way. So if you can get online, you could try to find older people who are online and reach out to them. Comment on their photos or on their posts and things like that. I think those are really good ways that people can help. If you're able to volunteer, I think that's a really important thing that people can do in the community as well. Some senior centers are available sort of by phone, where you can connect with them to see if there's a reach out list. We used to call them shut-ins. That's a term we don't really use anymore, but it's for people who don't really go out very much. And most senior centers, most town halls have a list of those individuals, and you can call and you can say, hey, listen, I'm willing to volunteer some time. If there's anyone who I can contact, I'd love to contact them and let them know that, they're not alone. People want to know that they're part of a community. It doesn't have to be a physical community. It can be an online community. It can be a phone community. They need to feel like they're a part of something. Because if you're not a part of something, I think that really eats away at your soul.
Yeah, and are you seeing, I don't know what exactly your research looks like on a practical level, but I wonder if you've heard concerns, or if you have, even if they're anecdotal, like if you're seeing this play out. Obviously there's pretty widespread fear, anxiety,
Yeah.
and even I think anyone who has struggles with mental health issues, depression or anxiety to begin with, this is obviously going to be harder. But do you think that this is hitting senior citizens in a different way than it would someone who's in their 30s, for example?
Yeah, there's a lot to unpack there. I think for sure that people are seeing it in a different way. I think social isolation before the COVID-19 epidemic,
Mm-hmm.
now pandemic, I think that before that hit, social isolation was already reaching what I would consider an epidemic level in the US and probably worldwide too. Although,
Sorry to cut, but in general or in in the elderly communities?
Yeah, with older adults.
Older adults.
So yeah, so I'm talking about older adults here. Anywhere between 10 to 50% of older adults would be considered socially isolated. I mean, a good middle number in a recent article is about 24%. It's an article looking at epidemiology of social isolation.
Mhm.
So if you're saying about 1 out of every 4 older adults was socially isolated when everybody was active and could move around in their communities freely. Now, what you're doing is you're basically sheltering in place. And when you do that, I think you've got that 25% of people plus everybody else who's now at risk. And I think what you're seeing now, and I think what you're going to see more and more, is the isolation is going to build up exponentially. So now you've got this infectious disease pandemic and also this sort of psychosocial epidemic happening at the same time. So I think that we need to be careful in the way we frame it. Most people will probably be fine when it comes to the pandemic. I think, there's smaller numbers of people who are getting really severe cases. I mean, we're seeing it a lot now because it's dramatic and it's very unsettling and for everybody.
Mhm.
But so many more people will get it and there'll be mild symptoms. So a lot of people will be just fine. And after this is all over and all epidemics, all pandemics, the epidemic curve eventually will end. People will get it and be immune. There will be a vaccine, there'll be medication, so it will end. And when people come out of this, they're going to have trauma related to all of this, I think. And some of that trauma is going to be related to this social isolation, this disconnection from their community. So if we can start building now people to connect with each other when people are able to come out, I mean, imagine meeting somebody online. Imagine texting them, calling them, video chatting them. And now we've got a vaccine. We're able to come out of the house. What's the first thing you're going to do? You're going to go see that person. They're going to get a big hug. I mean, it's going to be this really rewarding kind of thing. I think it's a really good opportunity for people to come together. And I think that's really what we can be doing now is kind of helping people get through and manage for when that big celebration day comes.
Speaking of celebrations, I mean, we've got Easter, for example, coming up, and Passover as well. Um, is there any, and feel free to completely shut this down, but is there any value in considering, for the sake of mental health, if you're an older person, taking that risk and seeing family members for a celebration, or should you really just stay away from that completely? How do you balance your mental health with your physical safety?
Yeah, I think it's really tough. I think that I do read articles that come out, and I don't think there's enough information out. The data I don't think is as reliable because it's not all coming from the US. I think it's coming from a lot of countries.
Mhm.
So I would be uncomfortable making a recommendation because I just don't think there's enough data. Anytime, we look at surveys and look at epidemiological data, we look at lots of people. And if we look at just a small amount of people, that doesn't give us a full picture. So given that I don't think there's enough data that I see, I would probably recommend doing a virtual Passover, doing a virtual Easter. Why not take the laptop and put it in, grandma or grandpa's place, or put the iPad there, and then maybe put some bunny ears on the back of it, and then everyone just has a meal together.
Yeah.
I don't think you necessarily at this moment, if you do a risk benefit analysis, I don't think it's worth the risk because we don't know enough about who carries and doesn't show symptoms, and who. So if you have a young child, maybe they're a carrier, maybe they can transmit it,
Right.
and they're not going to be very sick. Perhaps because right now we think, or people that based on the data think that that's not impacting children in the same way for whatever reason, but maybe they're able to transfer it to their grandparent who now comes for the holiday, and then they go home, and in 2 weeks they have a much higher risk because they probably have more comorbidities to become really, really sick. So that's a risk that I probably wouldn't take. I think you need to kind of pick your family and stay quarantined.
And yeah, it goes along with what you said earlier about, we don't know enough about this. So our primary defense against it is just not getting it, doing everything you can to prevent yourself from getting sick.
Yeah.
So I just wanted to circle back to something before I forget. You said it was 15% pre-COVID-19, 15% of senior citizens who face social isolation?
The numbers that I see are about 24%.
24%.
Yep,
Okay. And
24%.
so how do you measure that? What defines social isolation, and how do you quantify how many people are socially isolated?
Yeah, great question. One of the big, I think, considerations in the whole community of researchers who work with psychosocial factors, and there are many of them. So social isolation is one of them. Social support is another one. Social networks are another one. And there's many others like loneliness, and then you have aloneness and solitude, and I could go on and on.
Mhm.
So defining it really carefully is important. So the first thing is it's defined, and then it's measured in a national sample that is as representative as possible to the older adult population. So anytime I do research projects, I always use a few different instruments and I compare them. The instrument that I use now primarily to measure social isolation is the one that I created, which is the social isolation scale. It was designed specifically to measure social isolation. It was tested in a fairly large sample, which is was a national sample, not necessarily representative. I don't want to speak on the topic. There's an article out on it. People have access to this instrument. That's one way of measuring it.
Mhm.
So we would ask people to answer these 6 questions, and then we would look at the age group and the demographics and all of that. Other researchers have already done this with other instruments. And at the time, there's always what's the best instrument to measure this? How do we operationalize this construct? What does social isolation mean? So if we think it means objective and subjective, we better ask those kind of questions. And
Mhm.
that's what the social isolation scale does. But the study that I'm referring to uses a different instrument, which used to be the gold standard. To measure social isolation. But just like anything else, the concept changes over time.
Um, okay, so that's how you would quantify who is socially isolated based on these 6 or so measurements. But it varies by study. Is essentially.
Yeah, I think that there needs to be more of a common measurement, a more common way to operationalize the concept of social isolation. And that's what I'm hoping that the social isolation scale will be. That's why I put it together. There's a
Right.
definition that I have that we use, and in order to measure that definition of that concept, you would ask these 6 questions. And when you get the answer to these 6 questions, then you can look on a scale and say, oh, if you score between this and this,
Mhm.
you're at very low risk or no risk. If you're between this number and this number, middle, and then high risk or isolated. And it gives people an idea. It gives people, you can screen people. It's something quick you could do in a clinic. We could do it for research. And it's a way to identify people, because you need to identify people who are isolated or are at risk for being isolated. And then you can start looking at what we can do to impact things.
Right. Um, I was kind of just thinking. I mean, you've got social isolation. Does that have any impact also, or signify to any degree how people are getting their information as well? I'm just thinking about, is another challenge in this. There are senior citizens who aren't as tech savvy as your average like 35-year-old, or who don't see as many people. What is there any concern about them not getting the message about COVID-19 precautions, or the right information? Has that been a worry as well? I don't know if you would call that social isolation necessarily,
Mm.
but it seems to maybe go hand in hand with it.
Yeah, I think that older adults typically get their news source from a different place than perhaps that 35-year-old that you're talking about.
Right.
I think that most people of that age range, and certainly the students that I see in class, probably wouldn't get a newspaper. They probably wouldn't watch the news on TV. Rather, they would have a streaming service, or they would be looking online or have some apps. Now, this is something we often talk about in school, like what's a good source of information? Where do we go to get information? So we teach our students to go to reputable journals, government sites, and things like that.
Mhm.
I'm not sure if all older adults would be doing that. So my sense is that they probably are getting most of their information on the TV or
Or
like
from a
more
paper.
traditional sources, which would be newspapers. And now with people not really going out to get newspapers, sure they're being delivered, but I'm not sure about that. So I think that there's a possibility that they're getting incomplete information.
I mean,
Um,
the other worry is just how quickly things are changing. I mean, towns are sending out constant updates on this is closed, or this meeting schedule has changed, this budget process has changed, um, and or here are our recommendations about how to stay safe in the community. Here's where there are cases, etc. Um, and how can we ensure that folks who don't get their information primarily from the internet and might, which in and of itself has its own problems, but who might just get that paper every day, especially when there could be a lack of local coverage. That paper might not say exactly every measure that the first selectman of a town has taken, that citizens need to know about. How can we make sure that that message gets across? Is there anything you or I can do? Is there anything that uh, does that just go back to that, call the youngest person and learn how?
I think that's always a really good default. Call the youngest person you know. But I mean, honestly, I think that one thing that people could do that I think is really helpful is, again, if you're calling somebody who's knows a lot about technology, or perhaps you know a little bit about technology yourself, if you can get a few different news apps, I think it's really great. And to stay sort of apolitical, what I suggest to people, and tell my students this all the time: if you're going to look at a news source, look at one source as far to the left as possible that you know, pick one as far to the right as possible, and pick one or two in the middle, and read all four of them at the same time. So you can see what the top stories are, you could see what the next stories are, you can get a sense of the different viewpoints.
Mhm.
And the answer is always somewhere in the middle. It's never quite in one or the other. So I think that's really important, to look at different news sources and look at what's being said in different circles. I think another thing that's really important, if people can sign up for like the Connecticut governor's office, I think has an emergency sign up. Because I know I got a message. They dialed out to, I think, millions of people. I think 4 million people, something like that, about maybe a week ago. So that I don't know offhand, but I know there's a way for people to sign up for the emergency messaging. I think that's really important as well. If people can get connected with their school board or their board of ed, even if they don't have kids in school, a lot of information comes out through the schools and the board of eds. So you're talking about sometimes, like in situations like that, there's food insecurity. So a lot of towns are having drive-through drop-off lunches, that kinds of things for kids, and even for seniors, there's sometimes a small fee associated with that. So those kinds of things are programs that they could hear about by getting in touch with the Board of Ed. And a lot of time it's just like going on social media and liking it on, Facebook or something like that. It's a really easy kind of thing to do. I know a lot more older adults are on Facebook because they're looking to see pictures of their families too. So it's a pretty easy thing, and it's a good way to get communication. Now, the reliability of the news that comes out of the social media is a different story. I think people need to be very careful with the news that they're reading there. And that's why I don't suggest getting your news from those sources. I suggest getting them directly from the apps. Like I said, one on the right, one on the left, a few in the middle, and kind of read them all.
But you could get your programming information from social
Yes.
media.
I think you're going to get information is going to be pushed out through Twitter. It's going to be pushed out through Facebook, through Instagram, all these sources by the local officials. So the town, you can sign up for whatever town you're living in. So any information that comes out, it's going to be pushed through there because that's the most efficient way to communicate right now, as far as I can tell.
And then, so I know, I think we've been talking for almost half an hour. So there's a few things that I want to get to before,
Sure.
before I forget. And one thing that I was considering was, how does this social isolation play out differently for senior citizens who are living alone in a house, as opposed to senior citizens who are living in maybe an assisted living facility or like an affordable housing facility, which obviously comes with its own risk in terms of the spread of COVID-19.
Yep.
But does that also mitigate the impacts of social isolation?
Yeah, so I think it probably depends facility to facility. I think if someone's living in long-term care or assisted living, something along those lines, I think what you're going to see is different facilities have different policies about interactions. Some folks might have roommates, so obviously they're going to be a good source of support for each other because they're already there together. I don't think that they would be separated because it would make no sense because they're already, connected and they're already
Right.
together. I've seen a few really nice stories about engagement activities that long-term care settings are doing. So they'll have their residents sit in their doorways and they'll have like games that are going on down the hallway. It's a way for people to see each other and to connect with each other. I think those things are really, really, really good. Of course, there's risks for being in those kind of settings as well. You want to, of course, be careful about interacting with people just in the same way as you would in a house. I think every place is going to have their own policies. So I would recommend connecting with a program director or maybe someone who would know about the policies of the specific facility about what's being offered and what kind of engagement activities. But I think there are really great opportunities, and there are so many places being so creative because they realize that having your residents be socially isolated for an extended period of time is bad business. It's bad for their health, and it is overall, it's just bad for the soul.
What are some of the health consequences?
Of being socially isolated? Yeah, so there's a pretty long list of them. Some of the main ones are if you are isolated, just what they call all-cause mortality rises. So your total number of deaths due to any condition that you have, they rise. So you're just more likely to die in general by being socially isolated. So that's probably the scariest thing. You have an increased risk of being hospitalized or being rehospitalized if you're isolated, and that's the last place you want to be right now. You have a decreased quality of life, so now you also feel like things aren't as good as they used to be. You have an increased risk of having cognitive dysfunction, so you're talking about dementia and other things like that. You have an increased risk of depressive symptoms. I think we could all see why that would be the case. Depressive symptoms and social isolation are very closely connected. That's a concept that I always look at when I'm doing research because people who are depressed become isolated, people who are isolated become depressed, and sometimes people come in with a package deal, so we have to look at them together. And then substance abuse. People have an increased risk of drinking and using other substances when they're socially isolated. And those are all really negative health outcomes. And if you look at many of them, they're also quite expensive too. Outside of the risk of going to a hospital now because of COVID-19, just going to a hospital in general is really expensive. So that's something that we don't need in general. And even if COVID-19 didn't exist, there's also a lot of hospital-acquired infections that people could avoid by not going. And then depression is also very expensive. It's a chronic condition. Substance abuse, again, expensive, chronic
And comes
condition.
with its own set of
Yeah.
health health effects,
Yep.
side effects. Um, wow, that's
Yeah.
quite a
So
list. I, yeah.
so you want to avoid those. I mean, if you can help it, so being socially isolated is something that you want to prevent. But if
Hmm.
you feel isolated, or if you are isolated, there's more and more things that can be done about it. And that's sort of where I'm sort of moving my work now, is to try to help people to become less isolated, to become more socially engaged. So I'm hoping that will, so far things are looking good, but I'm hoping that can really help people, especially now.
Great. Um, I think that's a great place to a great note to wrap on.
Yeah.
I'm wondering, is there anything major that you think I missed that you were hoping to touch on?
Well, no, I don't think you missed anything major. I think one thing that I would add, since you
Hmm.
gave me the
Hmm.
opportunity, is I think it's really important for older adults to try to feel as normal as possible, just like everybody else.
Yeah.
We all need to have a sense of normalcy. So I know sometimes when people retire, because I hear it from the people that are older that I interview, and that they sometimes just don't set the alarm clock anymore. And if you don't have an internal alarm clock that you get up at the same time every day, um, I suggest that you set that alarm clock. And if you used to have an alarm clock, but you stopped setting it because of the pandemic, get that alarm clock out of the box, set it. I mean, you don't want to be eating lunch at 3 a.m. You want to feel normal. You want to go through your routine, get dressed, do your shower, your morning business, get everything ready, and then like start your day. Um, in fact, if you can get up a little earlier, you might even feel more productive. You can get informed, get online if you can. Like I said, pick a new hobby, learn something on YouTube, connect with the youngest person in the room, and try to figure out where you can go, what you can do next. It can be a nice time to kind of reach out to people you haven't seen in a long time.
Hmm.
Maybe
Hmm.
there's somebody that you know who's really far away. If you're on the East Coast, maybe they live on the West Coast. Why not say, hey, listen, well, I haven't talked to you in a couple of months, couple of years, but why not now? We're both home. Let's reconnect.
I think I mean, that's something that I've at least seen personally and among my friends, is people are reconnecting with people they haven't spoken to in a long time.
Yeah.
So it's one, perhaps a silver lining, but um, thank you so much, Nick. I
Yeah,
really
absolutely.
enjoyed this chat. Professor Nick Nicholson from Quinnipiac University, whose research specializes in mitigating the impacts of social isolation on senior citizens. And I'm just going to stop the recording.